welcome to this webinar series hosted by Happy Zest. Happy Zest brings to you a series of webinars on various health topics. This webinar is powered by Happiest Health, a global knowledge enterprise focusing exclusively on personal health and wellness. I'm Revati, and I will be your host for today's session on the topic seasonal changes and summer care for parents to take care of their kids. To discuss the same, joining us is Dr. Sudhir Yu. He's a consultant, Department of Neonatology and Pediatrics at Motherhood Hospital. Dr. Sudhir has been working at Motherhood since 2019. He's been well trained in NICU with good procedural skills and handles extreme preterm babies requiring ventilation, HFO, INO, therapeutic cooling. He's headed infection control programs and takes a special interest in training nurses and residents. He has experience in running high-risk newborn follow-up clinics, developmental pediatric clinics, and general pediatrics. He has 7 years of experience in general pediatrics and has been managing pediatric infections, vaccination, respiratory illness, growth and development, and has published articles and presented papers at various national conferences. Welcome to the webinar, Dr. Sudhir.
Good afternoon. Thank you for the introduction. So the topic of today's, can I go ahead, start the topic?
Start with a few questions, basic questions that we have as far as summer care for kids are concerned. And these are specifically tips for parents to take care of children during summer. The first question that comes to mind is, of course, hydration during summer. And my first question to you is, how much water should children drink during summer? Is there something as too much water or very less water? What is the quantity?
So quantity depends between from age to age. Like a water consumption for a 6 months to 1 year in that kid will be around 50 to 150 ml per day. So 1 to 5 year, it will further increase 200 to 400 ml. After that, it is 500 to 1 liter up to 4 to 5 years. So it varies from. So basically, what is their usual intake? So above that, the water has to be consumed. Little above that. So usually what happens, kids of at least up to 5, 6, 7 years, they don't ask for water by themselves. They will drink water when they are thirsty. So it should not be left to the point that they are thirsty. So water should be offered in between only. So depends on, some take good amount of water, some take less amount of water. It varies from kid to kid also, depending on their weight, body surface area. But the whole idea is usually what they take, above that, the water intake should be tried to increase. Just offering them whole day sips of water if they are going out to play, sending them with a bottle of water, instructing them that in between they should consume water, or if they are playing at home, you yourself as a parent just keep offering water in between. So that way they'll be hydrated. Especially the younger kids, less than 3-year-old, they don't take water so easily. So in that case, what you can do, especially in summer, you should offer a different form of fluids. See, water can be taken in any form. Having a coconut water also will give them water. Having a vegetable soup, fruit juice, buttermilk. So in multiple forms, if you offer, that way also the water content per day can be increased. So that way the water has to be offered for all kids, depending on their age group.
Okay. For an easy understanding, if you can put it in terms of liters, say a 1 liter bottle, then how many bottles of water or how many liters per day on an average? Because when we say a little more than usual itself, people don't drink as much water these days. So in terms of liters, if you can give us an estimate.
So as I told, up to 5 year, if they can consume at least 1 liter of water, so that will be sufficient. So after 5 to 8 year, at least 1 to 2 liter of water. So after 8 to 10 years, more than 2 liter of water they should consume. If that they are able to consume, so that should be enough.
Okay. Doctor, you also mentioned about fruit juices, but children also have plenty of fruits during summer. How safe is it to have cut fruits outside? This could have layers of bacteria and germs on them.
Yeah, see, cut fruits which have already been cut and kept, so that may or may not be hygienic. So usually what is the good thing to do is get fresh fruits from the market and cut it at home itself and consume it. Fruit juices also can be prepared with less salt, or directly they can consume fruits also. So cut fruits kept outside, you don't know. In fact, in summer, that is one major reason of the source of infection is food. Most of the times, parents assume that any food which is consumed outside only will cause infection. No, if you have cut fruits at home and you have kept cut in the morning, you are using it in the afternoon, especially in summer, the bacteria can go very easily, viruses and bacteria in summer. So even a home food which is stays for longer duration can be the source of infection. So that way, always fresh cut fruits. If they are planning to consume it now, so take a fruit, cut it now, and consume, everyone at home, especially kids. So that way will be the safest way possible to consume fruits.
All right. Is it fine for children to have refrigerated food? Because your first, what you want to do is when it's hot, you want to drink cold drinks, you want to eat something cold. Is it fine for children to have refrigerated food?
Not advisable usually for less than 5-year-old kids. More than 5-year-old kids, yeah, if it's very hot, see, especially if all the contestants are in Bangalore, are from Bangalore, usually refrigerated items, so much necessity doesn't come in a place like Bangalore. Yeah, there are in North Indian places where you won't be able to consume normal water at all during the peak of summer. So in that way, even the food also refrigerated, which is kept outside for some time, which is coming to the normal temperature, is a safe way to consume. Usually for less than 5-year-old kids, any water or anything refrigerated is not advised. Room temperature is sufficient. It's not necessary they should consume warm also. Just room temperature filtered water consumption is also enough.
All right. What are the diseases that parents should be aware of that is specific to summer as far as children's health is concerned?
So summer, the most common illness what kids face is gastroenteritis. Gastroenteritis is a form of tummy infection. Food poisoning, tummy upset, gastroenteritis, all are terms they use different way for different things. So most commonly, tummy upset or the food poisoning is because of food staying for longer duration, which has become stale. Some bacteria grow in that, and some toxins they release. So that is food poisoning. When food poisoning happens, there is usually no fever, usually vomiting and bad vomiting, and if or may not lose motion will be the accompanying problem. Other than that, the other common is gastroenteritis. Gastroenteritis is stomach and intestinal infection. So that can happen from virus and that can happen from bacteria. So viral gastroenteritis is one of the most common illness during the summer. Lot of virus thrives during that time, especially in food and water. Water which is not clean, not hygienic, outside water, or water which you have collected in a bottle, kept it for longer duration, more than 1 day, 2 day, and if you consume that water, or for that matter, as I told about fruits also, any food item also. Morning you have prepared a food item, you have kept it outside, afternoon, late afternoon, evening you consume it, that can also be the source of infection. So a lot of such news we hear, especially in apartment places, we hear that, yeah, in some particular apartment, there is onset of gastroenteritis, onset of cholera, like this. It's all common source of either water or food. So this is one of the most common illness. Apart from that also, especially if weather changes during the summer, like what has happened in Bangalore in last few days. So it was hot summer for some time. Suddenly there was rain, the weather became little cold. So that time seasonal change problems arises, and that time even throat infection, lung infection, viral throat infection also can happen. So apart from that, because of lot of sweating, especially in smaller kids, lot of skin related illness also can present up, especially smaller kids where they sweat a lot, they have very the neck fold is loose, the inguinal area, the skin fold, everything is loose. So sweat stays for longer duration anywhere in the body. So that can also irritate the skin, and normal bacteria which is staying around the body surface can enter that and cause infection. So lots of skin illnesses we see, illnesses to gastroenteritis we'll see, and as we already discussed about the consumption of water. So above that, if there is multiple vomiting or loose motion, they will end up with dehydration also. So acute gastroenteritis with mild to moderate dehydration is a very common problem, which is arises during the summer time. And also there are particular allergies are also more common during summer. It happens during rain. Some allergies happen during summer, because different weather, there are different types of pollens which are released from the gas. So if a particular kid is allergic to particular kind of pollen, and especially when that pollen arrives or is in the environment, that time the allergy comes up. So there are many kids who get a lot of allergic eye infection, allergic conjunctivitis it's called. Other than that, asthma exacerbation, allergic rhinitis. Allergic rhinitis is stuffy nose because of allergy. So for few kids, that is also very common during the summer. So this way, these are few of the common illness which present during summer.
Okay. What are the early signs when a parent should decide that the kid should be taken to the doctor? You say these are common problems, and what happens is parents tend to wait. They might wait for a day or two to see if the kid gets better, immediately give them some medicines that are readily available at home or always available at home. This is what is generally done in Indian homes. When is it the time that parents have to decide, okay, the kid must be taken to the doctor now? What are those signs?
So especially with gastroenteritis, as I told, it is a fairly common illness. So definitely most parents will have medicine for vomiting, medicine for loose motion, medicine for fever. So yeah, if there is onset of any infection, there are 1 or 2 episodes of infection, you gave medicine, it subsided, it stops. Yeah, you can wait. Yeah, if there is repeated vomiting, even after giving the medicine, if it continues, or it has been more than a day where the symptoms, see, younger the kids, earlier the kid has to be taken to the doctor. If vomiting, loose motion happens for a 1-year-old, there is no waiting or doing any form of home medication. Better is to get them to hospital. Yeah, if it is a 7-year-old kid, yeah, you can wait for 1 day. Already medicines which you would have used earlier, if you have it, you can give it. But yeah, if few episodes it continues, or there are signs that there can be some dehydration, some worsening. So such time the urine of the kid, urine output has come down, extremely dull, and mainly if oral consumption is affected. See, if they are having loose motion, but equally good amount of liquids they are consuming, ORS they are consuming, then they can wait for a day. If not, if there is very poor intake, high grade fever, signs of any form of dehydration signs, mainly what it will be, the urine output will come down. Tiredness will be there. They don't want to lie down completely. They don't want to take anything, do anything. If any such sign is there, then immediately the kid has to be taken to the nearest doctor.
Doctor, you briefly mentioned about the effects of seasonal changes as well. Now, especially in a place like Bangalore, one day it's summer, one day it looks like it's monsoon. There is a sudden changes. Can children really handle that kind of a sudden change in weather? And for those children who cannot, how can parents really be prepared for the effects of it?
Okay, so regarding the seasonal change, so what happens when there is a change in season? Suddenly there is some changes in a human body as well. There are some cells which changes, the total white blood cell count it's called. So that changes. So in a way, to put it in a simpler way, the immunity is slightly down when there is weather change. So that's what they call the feeling under the weather. So little immunity changes are there. So that time there are chances of getting any form of infection. Mainly the reason will be suddenly when the weather changes, there will be a particular infection which is going on in this particular environment right now. Season changes. Then what happens? There are few virus, bacteria which are dormant at that point. Because of change in season, suddenly they start growing and becoming. So then suddenly in that particular environment, whoever the people are in that during that season, they are not still exposed to that new infection. When that suddenly new infection comes up, suddenly it hits everyone, so everyone gets infected. So this is how the seasonal change works. Apart from that, as I told, allergies are also common during change in season. Different virus flourish, the immunity is down. So all of this will lead to a person or a kid getting affected from the infection. So I'll tell you, how many more questions do you have, or should I like talk a little more about this particular?
You can elaborate, doctor.
I'll elaborate a little more regarding this. So what happens though during especially seasonal change, a lot of viruses come up. There are different form of virus. You may have an idea that there are hundreds of viruses which can cause common cold, the throat infection. So in that, there are particular viruses which thrive suddenly when there is change in season. So which is very common, very frequent in a place like Bangalore. So that's why the chances of infection rate are also higher. And predominantly the affected kids are the school-going kids. less than in the age group of 2 to 5 years. These are the major chunk of kids who get majorly affected, because less than 2-year-old usually they don't go to school. They get this infection only if they are exposed. If anyone at the home has an infection, then the chances of less than 2-year-old getting will also increase. But if 2 to 5 years, they'll be, at least most of them will be going to school going age group. They are in very close contact. They are in a close space. Even, and usually in that age group, they don't have good etiquettes also. They don't understand that. So if a kid coughs in a school, close school, so the chances of other kids getting is very high. So then they spread it to everyone at the family. So that's how the infection starts. Say school going kids gets infected, comes back home, then from them, if there is any other kid at home, they get it along with that. Parents may or may not get it. So like that, the infection runs in the whole family during the change of season. So mainly throat infection related symptoms, stuffy nose, blocked nose, runny nose, coughing, throat pain. Other than that, these are all related to upper airway infection. If there is lower airway infection, then bad cough, wheezing, breathing problem, such things also can arise. So these are the common seasonal infections. So precaution, how to take precaution when there is seasonal change. So this I'll elaborate based on consumption of how these things will be. So first of all, I'll tell about food. So eating healthy, especially when there is season change, avoid eating outside food, junk food, or refrigerated items, cold items. Eating healthy. As I told, immunity goes down. So the food consumption should be mainly the home-based hot cooked food, and also items which can boost your immunity. So what are the items which can boost our immunity? Vitamin C. So eating citrus fruits during seasonal change. Apart from that, spices, different spices like cardamom, basil, pepper, all this also will help in increasing the immunity. Doing home remedies. Many families do that. There are some families who do it every day, but there are families who do when there is change in season, like consuming tulsi, turmeric, ginger, lemon. All this also will help in increasing the immunity. And a lot of antioxidants should be consumed. So that will all help in boosting our immunity, especially nuts, berries, and consumption of vitamin D, sun exposure, good amount of protein, mainly protein. So that's why good amount of protein, fibers, all this also will help in reducing the load of or the chances of our body getting a infection during the seasonal change. So this was about for food. So next is related to sleep. Good amount of sleep also will help in boosting the immunity. So we all know good 8 hours of sleep for an adult. For the smaller the kid, the longer the stretch is. Usually 1 to 3 years should sleep for a good 12 hours at a stretch in the night. This is a good night sleep what I'm talking about. So more than 3-year-old up to 9 to 11 hours. After 8 years, around 8 to 9 hours. This is the standard sleep. So good night sleep also will help in reducing the load of infection. Apart from the next, what comes is the respiratory illnesses, the vaccines for respiratory illness. That is the another major way where you can prevent infection. So the most common vaccines, whatever is a compulsory set of vaccines in the universal immunization schedule, predominantly most vaccines are for respiratory illness. So DPT vaccine, what is taken at a 6-week, 10-week, 14-week kids, that covers diphtheria, pertussis, then Haemophilus influenza. All these are different types of severe form of respiratory infections. So if you are covered with this, at least you are safe from at least this severe form of infections. So then comes the influenza vaccine. That is another major, very important vaccine. So influenza outbreaks keeps happening every year. So if I don't know if you are aware, last 2 months back, just take off H3N2 in many places of India, more so in Bangalore also. And there was adenovirus outbreak also. These are respiratory infection causing viruses. So we don't have a vaccine for adenovirus, but we have a vaccine for H3N2. So whoever is covered with it may just get either mild infection, or the chances of severe infection will be little less. At least 50 to 60% coverage it will give. So getting adequately vaccinated. And this influenza virus vaccine can be taken by everyone, not just the kids. So it is recommended for everyone, especially people who are exposed. More so before at least this COVID pandemic. So at least up to 5 years, we were telling the parents to get their kid vaccinated. And also it is advised for senior citizens who are more than 60-year-old. But now the importance is better for everyone to take it so that at least the influenza is covered. So apart from influenza vaccine, the COVID vaccine, so whoever has taken COVID vaccine, so that will also cover the coronavirus. Coronavirus is also a type of respiratory virus. In this one specific type of virus is COVID virus. Otherwise, there are other viruses of corona family, which is generally causing some common cold fever also. Main problem with this different types of common cold viruses, especially there are virus, enterovirus, adenovirus, rhinovirus, respiration syncytial virus. Usually there is no vaccine for any of this virus. So why? Because the virus keeps changing very frequently. I get a infection from a cold. I give the infection to anyone else. So in that time also the virus can shift its structure. So that way we don't have vaccine for common flu illnesses. But yeah, for whichever illness there are vaccines, so vaccine has to be taken adequately. So this is about vaccine. Next, about hygiene. So especially during change in season, little more importance should be given to hygiene, especially washing of hands. If kids go out and come back, so water and soap, the hands should be washed. Their legs, hands, everything should be washed. So that way also you can prevent a lot of infection. As I told, simple. Suddenly a virus has changed. There are a lot of such virus in the environment. So the point of infections will be either from hand, from air, or if someone is ill around it. So all these places, if you take little more precaution, the chances of you getting the illness will be little less. So apart from that, other important thing is keeping the body warm. See what happens, the weather now, suddenly the weather from hot to it has become cold. So our body also will feel that cold. So more so the head part, the ear part, the nose part, the mouth part, if these parts should always be little more warmer. Because what happens when the weather changes, our nasal mucosa, all this also will get affected. It may become dry. The chances, it becomes more susceptible to catch any form of infection. So keep self warm also will help, especially kids putting the cap on, using a scarf, using muffler, using the covering the ears adequately. So all this also has to be done when there is change of season. And apart from all this, the very important thing is mask. Mask came as a big way when the COVID virus, COVID infection came up. So, but after that, the mask is one way where you can prevent any form of respiratory illness. If you wear just a proper surgical mask, it's not necessary you have to wear an N95 mask. Good surgical mask if you wear, or if not possible for a surgical mask, a simple cloth mask also will reduce the chances of getting infection far in a larger amount than compared to not wearing a mask. So that way also, especially weather changes and all, when there is news of outbreak, suddenly people had stopped wearing masks. When there was outbreak, then again they started wearing masks for a few more days, few more weeks. So that way, especially season change, you have to take another precaution is by wearing mask. So in all this way, you can try to prevent from yourself and your kid getting any form of infection, and also avoiding overcrowded areas. Going to public places where a lot of close contact is there during any form of illness. And mainly 5-year-old, they contract infection from another kid, especially at the school. So parents taking precaution of not sending their kid to school if they are ill. So that is one major thing where you will be avoiding infection. The kid is ill, you give some syrup medicine, you control fever, and you send the kid to school. If kid is sneezing, especially in the first few days when the infection starts, that's when the infectivity is also very high. The bacteria virus load in the secretions, oral secretion, no secretion of the kid will be very high. And in a closed space, if the kid sneezes, thousands of bacteria or the virus is sent to the environment. And especially in a place, as I told, closed space where AC is used. So where there the air does not get filtered, there is no cross ventilation. So there the virus stays. So next kid, whoever there are kids, so they also can contract infection. So like this is the major chain which causes frequent infection in school going kids. you would have noticed. The kids, you keep them at home. That's why no one is getting much infection at all. Now, once the school starts in June, weather changes in June, suddenly there is onset of infection. They send to school in few days, the kid is back with infection. So you take treatment, the kid becomes okay. By the end of the week, next you send to school, again he gets another infection. This is a normal trend which happens, especially during seasonal change for a school going kid. So that time, putting the mask on and all other precautions, what I told about having good food habits, good sleep habit, having good etiquettes, and adequately covered with vaccine. If all those things has been covered or done, so the chances of the kid getting the infection will be lot less. So these are few of the precautions which has to be taken during any change in season.
Doctor, before I move on to the last couple of questions, gentle reminder to the attendees, if you have any questions, please post them in the Q&A box. We will take them up once the session ends. Kindly share your questions so that the doctor can answer them. Dr. Sudhir, my next question is, you did talk about a lot of precautions that parents need to take care of children, but towards the end, you mentioned about how when they go back to school is when they actually, the infection rises because the younger children really don't know how to maintain the distance from children who may not be that well, etc. Are there simple tips that, in a way that children can understand that parents can tell them to do, or what can schools really do in this regard?
So yes, so regarding the school, so school should have little stricter criteria that if a kid is ill, see, nothing happens. A 3-year-old going to a daycare school, if they don't go for 3 or 4 days, like nothing much will change academically. So especially school should have a stricter rule that if the particular kid is ill, they should take their time and the kid should be fever free at least for 24 hours. So that is the time when the infectivity will come down, then they can very well go to school. Apart from that, teaching, this holds good for both the school management also, teachers also, and the parents also. Teaching kids basic etiquette, especially wearing of mask wherever necessary. Just instructing kid to use a handkerchief if they feel like coughing or sneezing, and also to advise to wash their hand or remind their teacher to wash their hand once they cough or sneeze. And advising your kid also, because more than 2 years, whatever you tell them, they'll understand. They just need a lot of practice. You should, and it's not just instructing. You should do the same thing at home. Just do a practice of such things, especially wearing mask. Suddenly, what happens? You can't one day decide that you will put a mask. You'll put a mask on the kid and you'll go to school. No, you should start using that, training them at home. Just try to put them a mask on. See if tell them to be in the house, do some things for 15 minutes, 20 minutes. You see, because just wearing a mask is not important. So maintaining mask etiquettes also is very important. They have put on a mask, but if they keep on touching the front portion of the mask, after that they put their hand in their mouth or nose. So any such thing also. So just wearing a mask is not enough. Teaching them about the etiquettes also. Once they have put on the mask, they should not touch the front portion of the mask. If they have touched the front portion of the mask, they should wash their hand, or at least they should not touch their face, especially in a public place, crowded place, putting their hand in nose, mouth during all this time. Whatever the infection they have contracted on their hand can spread inside. So that way, basic etiquettes should be taught to kids, and that should be practiced at home first. See, kids follow what parents do. You should do it. You should follow it first. If you are doing regularly, seeing that, anyway, kids will start learning what to do. So all these basic etiquettes you should teach them. So these are few tips where how you can teach the kids.
I think we've covered most angles as far as summer care tips for parents to take care of the kids are concerned, and as far as seasonal changes are concerned. We do not have any questions from the attendees so far, which is generally good news. I'm assuming we've covered most parts of it. But in case there are any questions before the closing remarks, request the attendees to post them here. We'll answer them live. Dr. Sudhir, any closing remarks that you want to give, anything that you may want to add and I may have missed?
So nothing, mostly most things have been covered. So taking precaution, mainly precaution from your side as a parents also, and teaching the kids also is the most important part. So I see few good parents who take all proper precaution, especially when they come to a hospital. That is another thing they should understand, that the most common, many kids with different form of infection are there. So there at least the basic precaution has to be taken. And if you are able to do it there, you will start doing it elsewhere also. So putting on the mask, so keeping a handkerchief, using all the etiquettes, and also teaching the kids to do all this will go a long way in preventing such frequent infections in the kid.
All right. Thank you so much, Dr. Sudhir, for explaining in detail all those about the summer care tips for parents to take care of kids, as well as what to expect during seasonal changes and how to protect kids from those. Hope to collaborate with you again in the future. Thank you so much for your time, Doctor.
Thank you. Thank you for this opportunity.
Thank you, Dr. Sudhir. Thanks, Revanti.